So good afternoon. I'm Dr. Kevin Reed. I want to welcome you to our Facebook audience, to our MedStar Southern Maryland Hospital Center Ask the Doctors Lunch and Learn session. Today I invite you to join in while I talk about diseases, about the dangers of summer heat, and tips to stay out of the emergency room during your summer time frame. A little bit about myself. I've been with MedStar Health since 2001, so this is my 17th year with this awesome organization. I recently became chair of the emergency department here at MedStar Southern Maryland Hospital Center in August 2017. Previously, I'd been working in DC and Baltimore. So I want to make sure, your audience, that you're aware. You can ask questions or comments along the way, and I'll do my best to answer them as they come in. When we talk about heat-related illnesses, I want to kind of explain the two most common types. And again, if you have questions, please let me know. So as far as heat-related illnesses, we think about two general types. And when we talk about heat illnesses, we want to think of what are the ways our body can get rid of heat. The most common way that we will get rid of heat and the most effective is evaporation, sweating. So when you're outside, you sweat to help release heat. Other ways you can do it using a cold towel that helps conduct the warm energy to a cooler spot to get rid of the heat in your body. In addition, jumping in a pool or having water sprayed on you, that also helps basically convect heat from your body to the environment. So that's a normal way we try and get rid of heat day to day. Now, sometimes that regulation doesn't work, or we're out in the heat too long, or we're doing too much exercise. That leads to things like heat exhaustion or heat stroke. So what is heat exhaustion? Heat exhaustion typically is related to doing exertion outside in a warm environment. So when we think about this, we think about someone who has a known heat exposure, who has physical activity, strenuous exercise, or sports. Very common to see this, for example, in summer football players getting in training and shape. Typically, they'll have a high body temperature, somewhere above 98.6, which is normal, to as high as about 104 degrees or 40 degrees centigrade. Often they'll be dehydrated, but not always. Now, when we talk about heat exhaustion or heat stroke, this is more of a multi-system illness. This is where your body starts shutting down because it can't regulate the temperature. And that's characterized by a very high temperature of above 104 degrees Fahrenheit, very high, above 40 degrees C. And the difference between heat exhaustion, primarily heat stroke, is not only that very high temperature, but you get confused. You may be irrational. They may actually have coma or seizures. And that can lead to different systems in your body shutting down. So those are the two main differences. Heat exhaustion is the fatigue, exertional-related heat exposure, possible dehydration, and heat stroke occurs, again, once that regulation is no longer available to your body, temperature keeps rising, and you become confused and can have the seizures and confusion. Okay, we have a question we'll try and answer. So Casey wants to know, what outside temperature should I start to worry about heat exhaustion? It's a good question. There's no real set temperature because it's often related not only to temperature, but humidity. When you have high humidity, there's already moisture in the air. So when we talked about a few minutes ago, how do we get rid of heat? We sweat. Well, if it's already high moisture in the air, that ability to get rid of heat by sweating is less. But obviously you'll feel a difference between a 70-degree day versus a 90-degree day. So it usually is a combination of that heat, the actual temperature, and the humidity. Oftentimes on the news you'll hear about different alerts such as heat index. That's kind of a combination of that heat intensity along with the humidity. They also have health alert days as far as higher pollution days. So those, when you hear those high heat indexes, especially approaching high 90s to 100, any air quality issues or high humidity days, definitely above the 90-degree mark, those are probably times you want to really worry about heat exhaustion. Okay, great question. So we talked about heat exhaustion and heat stroke. Now, when we think of heat stroke, often that's from the exertion. However, especially in patients over age 70, you can get what they call non-exertional heat stroke. And that's basically because many of these patients over age 70 have a lot of underlying medical conditions that basically prevent them from either regulating their temperature, or because they are disabled or live alone, they can't actually get out of a hot environment. For example, if their air conditioner breaks or they don't have air conditioning. And often they may not be able to get the hydration they may need or cooling. These patients often have heart conditions, heart failure. They can have strokes, so they're bedridden or not as mobile. They may often have additional like psychiatric disorders to prevent them from taking the medications as routinely as needed, or have just day-to-day physical disabilities that make it hard for them to get out of that hot environment. So non-exertional heat stroke can occur, and we think about this in your elderly patients and those who live alone. And that's one important kind of safety tip when you're thinking about preventing heat stroke or other heat issues is have a buddy system. So, keep an eye out for others when the hot temperatures exist, especially the very young and the very old. Make sure you're checking in on them. Perhaps help assist them to a cooler environment on very hot days if they don't have the air conditioning or any way to get kind of taken out of that heat-related area. All right, just no questions right now. So what are the risk factors for heat illnesses? We talked about the extremes of age. We also talked about strenuous exercise where you have a high ambient temperature and humidity. Other things can be what they call lack of acclimatization, and that means your body's just not used to being out in the heat. So you're in air conditioning all the time and then you try and go run 5 miles. That may not be good because your body's not used to that heat exposure. If you have poor physical fitness, obese patients have a much higher risk also of getting heat illness. If someone is baseline dehydrated, that can put you at higher risk. If you have any recent illnesses, you had a recent infectious process going on, you had a flu or some other illness, your ability to regulate your temperature and deal with the heat stress is much harder. And the other things we call external loads. So if you're doing outdoor activity, you're wearing heavy equipment or protective gear. Oftentimes people will see people in the transportation, the highways, they're doing construction. They often have protective gear on, and that can really keep that heat in. So all those things put people at higher risk for any heat illnesses. So Brooke asks, my Nana had a heart attack years ago. That means she's more at risk for stroke. Brooke, that's a good question. Anytime you have a heart attack, there usually is some damage to your heart, so your ability to deal with stress is continually a bit less than it was prior to the heart attack. So yes, your Nana would be a bit higher risk for heat-related illness. So it's good to be checking on her, things we talked about, and making sure she's in cool environments, making sure she's taking her medications and getting routine exams by her physician or cardiologist. Okay, one other question. So Shelby wants to know, my son practices outside 5 days a week. I know he's young, but what can I send with him to practice to make sure he's protecting himself and staying safe? Shelby, that's perfect. Great question. So a couple things you can do. A lot of science has looked at prehydration. So the day before physical activity, making sure you're well hydrated, and that morning or afternoon before. Plenty of fluids. As far as at that actual sporting event or camp, the hope would be that they would have significant liquid refreshment there. Oftentimes they'll use salt and sugar substances like Gatorade or Powerade because you sweat a lot and lose different electrolytes and also lose a lot of fluid. Hopefully they'll be taking frequent breaks to get them out as well during that activity. In addition, because if he's not fully covered up, he has a higher risk of getting a sunburn. So you want to make sure he's putting on good lotion that's water resistant. And if he's sweating a lot, having him reapply that frequently during his activity. So pre-hydrating, getting plenty of rest, continued hydration during the activity, getting frequent breaks in shade, cooler environments, and applying that sunscreen multiple times will help keep your son safe. All right, another question here. So I want to say hi to Carol and Ruth. So let them know to ask questions if they have any. So Carol and Ruth, if you have any questions, please feel free. Here for assisting you in any way. We talked about some high-risk just groups. The other thing you want to think about, especially again in that elderly population, or if you have a recent illness, there are high-risk medications that put you also at higher risk of not being able to regulate that heat. Patients who have seizures, those medications cause issues. If you have a cough or cold or seasonal allergies, you're on an antihistamine or decongestant, those can also put you at higher risk. Anybody on any psychiatric medications. In addition, we talked about the heart patients. If you're on a diuretic, diuretics are medications that increase your urine output and help regulate your blood pressure, often in people who have high blood pressure or have something called congestive heart failure. In addition, something called beta blockers. That's a class of heart medicines often used in patients who've had heart attack or heart failure or for blood pressure. That also reduces your ability to cope with stress and have your heart respond to that. In addition, some other things you would definitely want to avoid, excessive alcohol intake or cocaine, also significantly increase your risk of having a heat-related illness or heat stroke. Okay, 2 questions. So Megan asks, I'm pregnant and can never seem to get cool. I'm also at risk for heat illness. Megan, that's a good question. During pregnancy, many changes happen from hormones and regulation of your temperature. In general, your temperature is just about the same, maybe a little bit higher. So from a standpoint of just the temperature itself, you're not at higher risk, but your body is working harder day to day because you're feeding two people, you and your baby. So your heart is working harder every day. So you are a bit higher risk for getting heat exhaustion and illness. So the recommendations to keep hydrated, get plenty of rest, cover up, avoid the excessive sun exposure. Keeping those cool environments would be very good for you and your baby. Okay, Bob has asked, I had a quadruple heart bypass surgery last August. Am I more prone to having a heat stroke or other heat-associated problems? My ejection fraction was just measured yesterday and is 53. I'm a 76-year-old male, very active patient. So Bob, very good. Let me just explain to those online if you don't know. An ejection fraction, that basically measures about how well your heart can squeeze with each beat. In general, a normal ejection fraction would be about 65. So Bob's, yours is a bit lower, and that could be related to the bypass surgery you had in the past. As far as being more prone to having heat stroke or other symptoms or problems, yes, again, because your ability to respond to the heat stress is lower, you are at higher risk. That does not mean you can't do your day-to-day activities or be outside. It just means you want to be very smart about limiting that very high peak times, especially between 10 a.m. and about 3 p.m. when the heat is very hot. The sun's very high in the sky and the humidity is usually very high. You want to keep hydrated. You want to take those breaks and stay in a cool environment. But you can still live your life in whichever you would choose, just with some knowledge about what to do when it's very hot outside. It's a great question. And you can still be very active. And I would continue to follow up with your cardiologist for that. I hope you have many active years in the future to come. All right, a couple other things. Well, we talked about kind of the difference between heat exhaustion and heat stroke. We talked about different risk factors that you may have or your family member may have. Let's talk about the symptoms you may have, because many of you may have experienced this. Often people feel that their heart is racing and going fast. They may feel very weak or fatigued. You can have a very dry mouth. You might have some coordination problems, feel lightheaded. Some people can even pass out. Often someone is profusely sweating, so they're sweating just profoundly, much more than usual. People will talk about that sensation of prickly heat, almost like a little reddish to the skin and tingling. That's another sign that your body's getting overheated. Often people will complain of a headache and will have abdominal and muscle cramps, sometimes even nausea, vomiting, and diarrhea. So you may not have all of these. You may only have one or two of them. But when you're outside in the heat, you're exercising, you want to think about, if I'm feeling this is my body telling me I need to take a break. And that means, get in shade, get in a cool environment, drink fluids. If you've been sweating a lot, consider the kind of salt and sugar containing solutions such as, Powerade or Gatorade. Obviously, you want to be careful to not have too much of that, especially if you have like diabetes or other sugar problems. That can really raise your blood sugar. But your average patient should be able to take that, one or two good glassfuls, and that should make you feel quite a bit better. And one big key about it is once you're feeling that, the recommendation is to try and kind of avoid heat exposure for the rest of that day. You don't want to say, hey, I feel great, I'm going to head back out there. Your body was kind of at its limit at that point. It's probably a good idea to try and remove yourself from that physical activity and that heat for the rest of the day if you can. So let's move on to heat stroke. This is, again, a multi-system illness, and usually one of the core things here is a very high temperature, but more importantly, someone is confused. They actually may have the dry skin. We talked about that very hot, warm, sweaty patient with a heat illness. Heat stroke is typically you've lost your regulation, your temperature continues to climb above 104, and you become confused. And this can lead to tissue damage such as kidney damage, liver, or even breakdown of skin muscle. Skin and muscle that can cause significant damage to your kidneys as well. Thank you. One thing I want to hit on also would be heat illness in children. It can occur. We talked about the teenagers and people outside doing sports activities. That is one thing. In fact, as far as teenage athletes, believe it or not, the actual number 3 cause of death in the U.S. of teenage athletes is from heat exhaustion. It only ranks behind traumatic and cardiac causes in healthy patients. So very high risk for teenage athletes. Young children, infants are also at high risk. And why is that? Well, they can't fend for themselves. They may be in a car seat. They're unable to escape that heat. So they can't operate the car door locks and get out when they're feeling warm in a car. So one key with this is people think, it's only on a hot day, it'll only be a few minutes. temperatures can rise extremely fast within minutes within a vehicle. And the outside temperature does not have to be over 100 degrees for this to happen. So you want to be very careful you never want to leave a child or infant or a pet unattended in a hot vehicle. Leaving the windows down is probably just not enough. They should not be in those very hot environments. And I want to make sure people are very much aware of that and do your best to not let that situation happen. Unfortunately, I think we've all heard over the years some very tragic cases of children or pets left unattended, and by the time they were found, they could not be saved. And so that is something we can all do day to day when we're taking care of our families and our pets to keep them safe. Okay, I have another question. Cameron wants to know, I live in a rural area not close to a hospital. If I think my loved one is suffering from heat exhaustion or having heat stroke, what can I do in the meantime to help them before I get to the ER? So Cameron, that's a great question, and many of you may live in a rural area. So obviously, heat exhaustion for heat stroke are two big, very things I want to make sure we kind of think about. So if your family member passes out, they are confused, they feel extremely warm, they are not acting themselves, those are possible signs of heat stroke, and that is a true medical emergency. So I would call 911 to help get the treatment started. As far as the interim, whether it's a heat stroke or heat exhaustion, what can you do? Remove their clothing. You can do, if you get a spray bottle filled with a bit of water, spray it on their body. And if you have a fan, that evaporation is actually the most effective way to help with cooling. If they're awake and alert and not confused, cold fluids, we talked about the Powerade or Gatorade or something similar can help. If someone is progressing, sometimes we will do cold packs, sometimes in the axle and the groin, to help get that temperature down. Some studies have actually shown if you just place a cold pack or ice pack on the head, on both palms and the feet, that is actually very effective as well for getting that conduction of heat from your hot body to the cooler environment. There may be some shivering, so you may need to cover them up with kind of a loose blanket or a loose, thin sheet to help keep that, because actually shaking, unfortunately, increases your temperature because of all that muscle tremors. So if someone comes in the emergency department and we're treating them very aggressively and they start having tremors, we actually give medications to help get that down so that heat production goes down. So what you can do is get them out in a cooler environment, get them undressed, do the spray bottle with water, use a fan, those are very effective. The cold compresses or ice on the extremities can help as well. But again, if you have any concerns, if it's not just, I'm having stomach ache, I'm a little nauseous, my legs are crampy, I feel hot. If it's progressing, they're confused, they're not acting correct, or the skin is very hot and dry, that means they've lost that regulation, then you're going to heat stroke, and that is a true medical emergency. You need to call 911 urgently. Okay. I have another question that just came in. Haley asks, my husband plays rugby. I like to attend games and support him. Just had a baby, so now I feel like I can't go. Is there a safe way I can bring my 3-month-old so I don't have to worry? So Haley, that's a wonderful question. So I have a 14 and 12-year-old, so I'm a bit away from the baby age. However, most of the strollers, as well as some of the car carrying seats, have shades that you can put on to help keep your little one safe. There are often little half-tent devices where you can put that on the ground, give some shade where you can put your baby while you're there. I think you want to keep them hydrated, as we talked about, those frequent breaks. As long as they don't have direct exposure to sun, and as long as you have them in a shady area, they're probably okay, at least for a certain amount of time. And as far as exact time, it depends on, again, the temperature. A 100-degree day is very different than an 80-degree day. But I think if you try and protect them from the sun, you keep them hydrated, you take breaks, you should be able to enjoy your family activities. And I wish your husband best of luck with his rugby games, because I know it can be very tough. Please help him keep safe. Watch out for the head injuries. We don't want to see him in the emergency department for that. So we talked about the different heat illnesses, especially in children, what you can do. So what do we do as far as treatment? We talked about most of this. Stop that exercising immediately. Move to a cooler environment. Get that natural shade, air-conditioned vehicle or air-conditioned building. Excess clothing should be removed. The kind of salt-containing liquids, flavored sport drinks, in general, with these measures, most people will do well. They will not have any issues and they will be fine. Again, try and avoid that re-exposure on that day. Heat stroke, we talked about, some medical emergency. Do what you can to keep the patient cool until EMS or 911 arrives. Once we get in the emergency department, again, we would have them undressed. We would do that evaporative cooling. We often have special devices called cooling beds that actually help circulate cold water to, again, get that temperature conducted into that to get the body temperature down. and we will sometimes control those tremors with sedatives. There are times where patients are so ill and sick we have to put them to sleep on something called a ventilator until we can get that temperature down. And we will basically give them fluids through an IV, medications control those tremors, do what we can to get that temperature down as quick as we can, and look for any signs of what they call organ damage, kidney failure, stress of the heart. Really what we're doing is supportive care. We're just trying to get the body's temperature back down to a level where it can be regulated, give them hydrated, and make them feel better. So that is the treatment we're going to be doing for kind of heat exhaustion versus heat stroke. So let's see, we have another question here. Tamara asked, I'm originally from Florida and moved back 5 years ago. I'm susceptible to heat stroke exhaustion. Why is it that I don't realize it's coming on until it's too late? That's a very good question. So it's interesting you mentioned from Florida. So day to day and even during the summer, you may have been more acclimatized actually in that environment because you were exposed to that stress over every summer. Now, as far as why don't you realize it's coming on until it's too late? Well, at the end of the day, most of us can do a certain amount of exertion and be in the heat, and we kind of know where we're going. Our body tells us where we are. When it comes to heat exhaustion, everybody's set point is different. Just like an athlete may have a different level of training than another athlete, or someone has a different medication they're on that puts them higher risk. So your set point is just a bit lower, and that's kind of your risk. As far as you don't realize it's coming is because most of the time your body is regulating itself very well, and all of a sudden it just loses its ability. My guess is if you think about it, you may also find that there are some earlier symptoms or signs you're finding. You feel a little more tired than usual. You're sweating a lot more than you may. You may start feeling a little bit nauseated. You may have a couple cramps. So those are kind of early signs. So I would just be very aware. Your body's telling you these things. Just be very aware and cognizant and say, hey, maybe I should pull back a bit. And I'm hoping that having that early kind of warning signs may help you feel that a little bit better. But as my guess is the fact that you've moved here, you probably actually lost some of that ability to be as ready for that stress. And unfortunately, we get some very warm, hot, muggy, I'll use the word sometimes miserable summers here in the DC area. Hopefully your body will get used to that. But I would do all the things we talked about to prevent that, but just be very aware of those early signs. And I think that should help you move forward in the future. Okay, so still have room for more questions. Please feel free to send them in. Kind of want to go through just a couple of things. We talk about some tips of really, how we can prevent damage to our bodies, to our skin, and try and keep us, again, out of the emergency department. A couple just start on the outside in. So skin damage, the sixth leading cause of cancer in the U.S. is actually malignant melanoma. Melanoma is a skin cancer you get. And typically, it's almost directly related to the amount of sun exposure you have as a kid or a teenager, so having recurrent sunburns and just prolonged skin exposure, as well as using tanning beds. Please don't use tanning beds, okay? Put you at much higher risk of getting skin cancer. So, doing what you can to protect your skin, putting on high SPF lotions, don't put on the tanning oils, all those things. Those just basically you're trying to turn yourself into something that is going to get baked in the sun. You want to protect yourself from the sun. Most authorities recommend something usually above about a 30 or at least a 45 SPF, and there are ones as high as 70. There's a lot of discussions whether 70 is really more effective than 35. I think the way I would look at it is putting on something with a high SPF is better than putting on nothing. And you want to get all areas, including your face, neck, arms, and legs. You also want to cover your lips as well, so you can get a chapstick or other, because those can burn as well. For those of you with thinning hairlines or other, please wear a cap or hat. And it's also recommended you wear, even in general, anyone a wider brim hat, because that really protects the head, face, and neck. Because day to day in our lives, that's probably the most exposed part of our body. Even on a winter day, your body's exposed to that. So those are good things to help prevent that skin exposure. Let's see here. Question from Rachel. I've heard certain medications put you more at risk for heat illness. I have anxiety and take antidepressants. Does that put me in that category? Rachel, there are some specific medications that can in those categories. My suggestion, because some have a higher risk than others, I would talk to your physician who prescribed them, or actually one of the best is probably your pharmacist. They'd be very knowledgeable on that specific medication. There are other websites you can look at, places like WebMD or other sites that actually have good information on medications. And typically what I look for when I'm looking for medications, I'll just look at what are the common side effects. and it'll typically list whether you're at higher risk for that. So I would talk to your doctor prescribing that or the pharmacist. They can be a wonderful resource to get you that information. But it's a great question, and that is a class of medications, certain ones in those areas for treating depression, anxiety, schizophrenia do put you at high risk. So please ask your physician or your pharmacist about that. Okay, so as far as some outside tips, we talked about stay hydrated. Please drink water before and after heat exposure. Avoid alcohol, that can cause further dehydration. Dress down, so wear hats. Clothes that are light colors, lightweight and loose fitting to help regulate your temperature when you're outside. Stay in the shade, right, out of direct sunlight, so trees, umbrellas, awnings, overhangs. Timing, the best time to be out is early in the morning or late in the day. That's when the heat and humidity haven't risen so much that you can't regulate your temperature. So if you want to take your morning walk with your pets, you want to get a morning walk in, you want to do gardening, early in the morning, late in the day are much better times for you. Soak, cool down with a cool shower, pool or garden hose, run through that sprinkler with your kids, and apply the sunscreen. Those are outside tips you can do to help prevent sun exposure and sun risk with heat exhaustion. As far as inside, if your house doesn't have air conditioning, even if it does, block the sun from getting in by putting up curtains or shades. Helps keeps that regulation temperature outside. Keep the AC set to cool and maintain by make sure you check your filters, okay? Oftentimes they'll shut down and freeze up and then you're out of luck for a week or two, so check those filters routinely. Ventilate with fans to keep air circulating. This is another good suggestion, I think. Avoid using the oven during peak time. So when it's really hot out, don't do the baking or cooking during that time. Do in the mornings, do in the late evenings. Make sure you keep lids on the pots. Again, all that boiling water, that air is getting out into the environment and making your house warmer. So do what you can to mitigate that heat while you're cooking with pans and pots. As far as the cars we talked about, never ever leave children or pets unattended in the vehicle, even with the AC running, because the AC may break down, the car may break down. And again, that temperature is going to rise very quickly. You want to check your AC and refrigerant levels and engine coolant levels. Obviously, if you're not handy with a car, go to your local service station to get that checked routinely. And I also recommend you also keep an emergency kit in your vehicle, whether it's winter or summer, always having a bottle of water, something to eat, and something to help keep the car cool are great things to help on a hot summer day. As far as pets, similar to the children, never leave them in an unattended car. Take those walks early and late in the morning, or late in the morning and late in the afternoon. Fresh water should always be available inside and outside if they're outside, and avoid walks during the hottest part of the day. Just in general, actually, let me pause here. We got another question here. So Trent is asking, I have to wear a heavy uniform for my job as a construction worker, spend a lot of time outside for long periods of time. What can I do to help myself and my buddies feel better on the super hot days? It's the worst. Trent, I can only imagine. Driving by in the air-conditioned car, seeing you outside working hard. We very much appreciate what you're doing to make our travel better, but I can understand how that's very hard for you. We can't change your uniform. I absolutely understand that. Definitely far as if you have to wear an undergarment under that, there are some clothes that help wick away moisture and heat as an underlayer. The frequent breaks, wearing the hats. There are, different, chamois or towels that are kind of cool devices. You can throw them in a freezer. Put a couple of them in a cooler or a couple ice packs, and during your breaks, use those to help kind of get that convection, conduct that heat off of you. Lots of fluids, and probably the best things you can do. You may not be able to change your job, but when you're on your break, you should be able to do the best you can to keep cool and stay well hydrated. And if you develop these symptoms and you're not feeling well, you'll let your boss know about that, because that's something that you may need to address here with us in the emergency department if it progresses, or get removed from that environment, cool down, take a break, get lots of fluids in you. And I hope you can stay cool on those hot summer days out there. Other things we talked about, just, in general, we talked about kind of external, protecting your skin and your home and environment, what to do with cars, what to do with children and pets. Really you want to try to avoid working outside if possible. Unfortunately, Trent cannot and his team, but if you can, try and do that in the morning or evening. Visit cooling centers. So there are public cooling centers in many areas, or public places with air conditioning, malls, stores, libraries, restaurants, all great ways to get away from the heat. I want to reiterate that idea of that buddy system, especially those who have a lack of access to health care or may live alone, the elderly, the extremes of age. Please check in on them, make sure they're okay, make sure they have a plan for what they're going to do when the heat gets there, assist them getting into cooler environments. make sure they're well hydrated, make sure they have electricity and power if they have fans or AC. You can go a long way because those interventions, they seem very small. They can, I think, actually can save a life. Year to year, there are unfortunately a number of people who pass away, especially elderly with medical conditions we talked about, on medications, who live alone, who are disabled, who, when there's heat spikes in Chicago or certain cities, unfortunately they pass away because of heat stroke, and they don't get that care they need in an early time. So whatever we can to help take care of our neighbor, I think, is a great idea.